certainly, the numbers of doctors that we have are, I believe, sufficient. They're not the best numbers that we can have, but considering that we have close to 1,000 fully registered medical practitioners, several hundreds in institutional registration, I believe we do have a formidable base on which to fall back to fight the disease.
Okay.
And I believe a lot of it is the proper coordination and focusing on where we need to tackle the disease. Medical Council continues to work during this crisis to help its physicians and, of course, the entire medical fraternity. We are working with our stakeholders, including the Ministry of Public Health, PAHO, the private institutions, to ensure that we have as optimal resources as possible for our doctors and nurses and other providers to care for patients. And particularly, we have been most recently dealing with the expansion of testing for the disease and also on management protocols that are applicable to very sick patients. Additionally, the Medical Council has facilitated through the two major telecommunications services, that's GT&T and Digicel, to provide relief for data and call services for healthcare providers. The institutions themselves, the regional health services at the regional hospitals, have been conducting ongoing training in use of personal protective equipment, PPEs, and so has the Georgian Hospital. And this is also an initiative, I understand, is happening at the private hospitals. So definitely training on personal protective equipment for the health personnel who are on the front lines, and there are specialists training in intensive care and critical care for these patients who contract the disease and have critical disease for the personnel to be able to manage these effectively. I'm also very confident that those on the front line will continue to work hard and effectively, ably supported by other health personnel and administrative personnel and other support persons in doing their best. And I know sometimes in the face of adversity and bad outcomes, health personnel are usually challenged and sometimes can become dejected. And also criticisms, sometimes unwittingly or ill-informed, can also make them a bit dejected. But I ask them to stay focused on the challenge in front of them and keep working hard and effectively against the COVID-19.